How are all these changes going to benefit me and my family?
How is this going to affect maternity in children?
Won't it take longer to get to hospital?
I've got my own views on this. How do I get involved?
Paediatrics and Children's Services reconfigured to the Calderdale site in 2008. As it exists, the majority of doctors and nurses that work within paediatrics are based here at Calderdale. But we do have some patients over at the Huddersfield site, and those are predominantly children, not babies, who need surgery in the emergency setting. Unfortunately, though, we don't have the same level of consultant input on the Huddersfield side. Having one emergency centre for everyone, where actually we can make sure that the appropriate support and the appropriate teams are in place, would make things a lot safer for all of our patients, not just for children. But I think it's also a really exciting opportunity for children in this area, because we could have an emergency centre specifically for children. So this is not just going to be a part of the hospital where children are kind of tagged along. This will be a specialist unit for children and young people, staffed by specialists, both doctors, nurses, therapists in paediatrics who can be there on hand in an emergency, and in an environment that's suitable for children as well. And children in particular don't come to hospital with any obvious diagnosis, and having members of the team with different aspects of expertise available on one site, in one place, at one time is really important. And I think it's really important that people realise that actually both children and adults sometimes have to go beyond where their nearest hospital is, not because that hospital won't be able to look after them, but actually the specialists that they need aren't always at their closest hospital. When we look at the staff that we're trying to attract, but also keep here in Calderdale and Huddersfield, this will move us towards having a really specialist centre that will attract more doctors, more nurses, and more therapists who will want to come and work in this hospital. So another thing that I think we can really look to working towards would be to have more consultants here outside of normal working hours, and having a specialist dedicated unit that is part of a children's emergency department will definitely seem attractive to people wanting to come and work here. I can really understand why the public would feel that this is purely a cost saving or a cost cutting exercise, and that we're doing this purely for financial reasons. Actually, there are significant benefits not only to the children and young people that will come into children's services, but also the staff. They will say to you, being on one site is by far the most important thing to us. It's really important that members of the public share their views with us and work with us to try and make this even more successful than we'd ever imagined. And they can do that in a number of ways, by either attending one of the events being organised in Halifax and Huddersfield, but also by completing the surveys. And they can do that either by going online or picking up a paper copy of the survey either at community centres or even their local GP practices.